Every heartbeat tells a story. For most of us, that rhythm, steady and unnoticed, marks the quiet passage of time. But for some, the rhythm falters, races, and stumbles. It becomes a source of fear, fatigue, and uncertainty. This is the story of Mary, a 66-year-old woman whose heart wouldn't stay in rhythm, and how the right diagnosis and timely care restored her health and peace of mind. It began quietly enough, episodes of fluttering in her chest. At first, Mary brushed it off as anxiety or too much coffee. But soon, her heartbeats turned into storms, racing, pounding, unpredictable. When she finally went to the emergency department, her heart was beating 128 times per minute, far above normal. The diagnosis was clear: atrial fibrillation, or AFib, the most common serious heart rhythm disorder in older adults. AFib means the upper chambers of the heart are quivering instead of beating effectively. It's not just uncomfortable, it can cause blood clots that lead to stroke. Mary had risk factors, high blood pressure and a history of breast cancer, but her heart muscle itself was strong. Still, because no one knew how long she had been in AFib, doctors couldn't safely shock her heart back to a normal rhythm right away. Instead, they prescribed a blood thinner to prevent clots and adjusted her medications to slow her heart rate. She was stable enough to go home, but uneasy. Mary's family doctor wanted her not just to have a slower heartbeat, but a steady one. After 3 weeks on blood thinners, she underwent a brief electrical procedure, a cardioversion, to restore normal rhythm. It worked. For the first time in months, Mary's heart felt quiet again. She started a medication called flecainide to help keep her rhythm regular. But just 3 weeks later, the familiar pounding returned, another trip to the emergency room, another cardioversion, and another reset. This time, she was referred to a heart rhythm specialist, known as an electrophysiologist. But the wait for a definitive procedure, a catheter ablation, was extended. Too long in her part of the world. Nearly a year. 3 months into that waiting period, things took a frightening turn. One evening, as Mary was folding laundry, she suddenly went pale and lightheaded. The world blurred. She sank into a chair as her heart raced, then seemed to stop. Her home monitor showed what doctors later confirmed: her heart was alternating between speedy beats and dangerously slow pauses, sometimes stopping for more than 4 seconds before restarting. This was tachy-brady syndrome, a chaotic pattern where the heart speeds up, then slows down so much that it nearly stops. In tachy-brady syndrome, the heart's electrical system becomes unpredictable. A pacemaker can prevent long pauses, but it doesn't fix the root cause, atrial fibrillation. Mary's care team faced a difficult choice. Should they implant a permanent pacemaker to protect her from those long pauses? Or perform an urgent catheter ablation, a minimally invasive procedure that could eliminate the source of her arrhythmia entirely? Mary was clear: if possible, she wanted to fix the problem, not just manage it. Within days, her doctors performed the ablation. Using a thin tube threaded through a vein, they carefully delivered tiny burns around the pulmonary veins, where erratic signals in AFib often begin. The next morning, her heart was steady. Mary went home the day after her procedure. She stayed on rhythm medication for 2 months, just as a precaution. But something remarkable happened: her heart stayed quiet. Over the next year, checkups confirmed it: no more AFib. No more dangerous pauses. She no longer feared sudden dizziness or fatigue. She could take long walks again, garden, and sleep through the night. It's like getting my rhythm, and my life, back. I didn't realize how much I'd been living around my heartbeat instead of with it. Mary's journey highlights something far bigger than one person's experience. AFib is common, but treatable. What made the difference in her case wasn't luck. It was awareness, persistence, and access to specialized care. Yet, too often, that access comes too late. Many patients spend months or years cycling through medications that don't work. Women, in particular, are less likely to be referred to heart rhythm specialists, even though they often have worse symptoms and higher stroke risk. Research shows that early rhythm control, whether through medication or ablation, can reduce strokes, hospitalizations, and even death. The sooner we act, the better the outcomes. The message is clear: don't wait for your heartbeat to decide your fate. If palpitations keep coming back despite medication, ask your healthcare provider: should I see a heart rhythm specialist? Catheter ablation is not just a last resort, it can be a first-line option for the right patient. Managing risk factors like high blood pressure, weight, sleep apnea, and alcohol use can also help keep AFib under control. Mary's story is one of resilience and restoration. It's also a reminder of how powerful the right care, at the right time, can be. Behind every diagnosis, there's a person trying to live their life, someone folding laundry, playing with grandchildren, or simply hoping for one quiet heartbeat after another. Key lessons from Mary's journey: AFib is common, but not inevitable. It can be managed, controlled, and sometimes cured. Persistent symptoms deserve attention. Don't settle for uncertainty, seek specialized evaluation. Early intervention saves more than hearts, it restores confidence, independence, and peace of mind. Today, Mary's heart beats quietly and confidently, steady as a metronome. Her story is a testament to the power of persistence, partnership, and modern medicine. For anyone living with AFib, or caring for someone who is, remember this: your heartbeat matters. The rhythm of your life deserves attention, compassion, and the best care available. Thank you. I hope you find this informative.